Picture this. It is 2 in the morning. Your bedroom is completely quiet. You finally fell into that deep, heavy sleep your body desperately needed. And then the signal comes, that familiar pressure building somewhere at the edge of your awareness. You try to ignore it, you roll over. You tell yourself it will pass. But it does not pass, so you throw back the covers, drop your feet onto the cold floor, and shuffle to the bathroom half asleep. You do what you came to do. You come back to bed, and sleep is gone. Your mind starts running. You lie there for an hour. You finally drift off again, and then 2 hours later, it happens again. By morning, you are exhausted, foggy, and running on caffeine just to get through the day. And you tell yourself the same thing millions of Americans tell themselves every single morning. I guess this is just what getting older feels like. I am Dr. Arthur Vance, and I want to tell you something directly. That is not what getting older feels like. That is what a specific, identifiable, and very often completely fixable problem feels like. Getting up repeatedly at night to urinate is not a normal part of aging. It is a medical condition called Nocturia, and it is a signal that something in your body is not working the way it should. Tonight, I want to explain exactly what that something is, why it has almost nothing to do with your bladder, and what you can do about it starting this evening. Here is the fact that surprises almost every patient I share it with. In roughly 80% of cases where someone is waking up multiple times a night to use the bathroom, the bladder is completely healthy. It is not the problem. It is simply doing its job, emptying what gets put into it. The problem is what is filling it during the night and why. And the answer to that question is almost never what people expect. Most people who come to see me about this have already decided what is causing it. Men say it must be the prostate. Women say it is menopause or a chronic bladder infection. They have already tried the supplements advertised for urological health. They have cut their fluid intake so aggressively that their mouth goes completely dry by 7 in the evening. They stop drinking anything after dinner. They go to bed thirsty, and they still wake up at 2 in the morning with a full bladder and cannot figure out where the fluid is coming from. The reason those approaches do not work is because they are all aimed at the wrong organ entirely. Before I explain the real mechanism, I want to mention a few symptoms that should send you to a doctor rather than to a video. If you ever notice blood in your urine without pain, that combination is serious and needs immediate evaluation. It can be an early sign of bladder cancer and should not be waited on. If nighttime bathroom trips are accompanied by bone pain and unexplained weight loss over a few months, that needs a doctor right away. And if you feel an urgent, desperate need to urinate but nothing or almost nothing comes out and your lower abdomen aches, that is urinary retention and requires urgent medical care. If none of those apply to you, keep watching because what I am about to explain changes everything about how you understand this problem. To understand why your bladder keeps filling at night, you first need to understand what is supposed to happen in a healthy body during sleep. Your brain produces a hormone at night called antidiuretic hormone, sometimes called vasopressin. Think of it as a message your brain sends to your kidneys every evening that says, slow down, work in economy mode, concentrate the urine, and reduce the volume. This is precisely what allows a healthy person to sleep 7 or 8 hours straight without a single bathroom trip. When that system breaks down, your kidneys keep working at full speed through the night, your bladder keeps filling, and you keep waking up. The question is, what is disrupting that system? And in most people over 50, the answer is fluid that has been pooling in your legs all day. Here is the mechanism that explains almost everything. During the 16 hours a day that you are upright, standing, walking, sitting, gravity constantly pulls fluid downward toward your feet and ankles. When we are younger, the veins in our legs have strong elastic walls and well-functioning valves that prevent blood and fluid from pooling. The muscles in our legs, when we walk regularly, act like pumps that push fluid back upward against gravity. But as we age, especially if we spend long hours sitting at a desk or on a couch, those vein walls lose their elasticity, the valves begin to weaken, and the muscle pump shuts down from inactivity. Fluid starts to seep out of the blood vessels and into the soft tissue surrounding them. In the loose connective tissue of the lower legs, up to 1.5 liters of water can quietly accumulate over the course of a day. You may barely notice it. Maybe your socks leave a slight groove in your skin by evening, or your ankles look slightly puffy. but you do not think much of it. Then the evening comes. You have a large dinner, sit in front of the television for a few hours with your legs down, and gravity keeps doing its work. Fluid keeps collecting in the tissue of your calves and ankles. Then you turn off the television and lie down to sleep. And this is where everything changes. The moment you lie down, your legs rise to the same level as your heart and kidneys. Gravity no longer holds that accumulated fluid down in your legs. All of it, every bit of that 1.5 liters that collected in your leg tissue over 12 or more hours, begins rapidly returning to your bloodstream. It gets reabsorbed into the veins and rushes toward the center of the body within an hour of lying down. Your heart suddenly receives a surge of extra fluid volume it was not expecting. It recognizes the system is overloaded and releases a specific hormone that sends an urgent message to your kidneys. The message is essentially this: dump the excess fluid immediately, or the heart will be under dangerous strain. Your kidneys respond by shifting into high-speed filtration mode, rapidly expelling water and sodium to protect the heart. Within an hour of lying down, your bladder is full. You get up and go to the bathroom. But the fluid from your legs has not finished mobilizing. The process continues for several more hours. 2 hours later, full bladder again, and the cycle repeats until morning. This is why people who have not had a single sip of water since 6 in the evening wake up producing large amounts of urine at 2 and 4 in the morning. They are not urinating what they drank. They are urinating the fluid their legs stored during the day. Now let me show you 2 simple tests you can do right now to find out whether this is what is happening to you. The first test takes 30 seconds. Sit comfortably and expose your lower leg between your knee and ankle. Find your shin bone, the hard surface along the front of your lower leg with no muscle covering it. Place the pad of your thumb firmly against that bone about 4 to 6 inches above your ankle. Press firmly and hold for 10 to 15 seconds. Then remove your thumb and look at the spot. If the skin springs back immediately and feels smooth and flat, there is no significant fluid accumulation. But if your thumb left a small pit or dent that does not fill back in for several seconds, a dent you can both see and feel, you have just found a hidden reservoir of fluid in your leg tissue. That fluid will move through your kidneys tonight while you are trying to sleep. The second test is a simple urine diary. On your next day off, measure your urine output separately during the day and during the night using any measuring container. Add the numbers up. If your nighttime output, everything produced from when you go to bed until you wake up in the morning, adds up to more than 1/3 of your total daily output, that is officially called nocturnal polyuria. Your kidneys have essentially inverted their schedule and are doing most of their work at night because of the fluid redistributing from your legs. If both of these tests point in the same direction, your bladder is almost certainly fine. The problem is in your circulation, your fluid distribution, and your daily habits, all of which are completely addressable. Now let me talk about what you are eating and drinking in the evenings, because food plays a larger role in this than most people ever realize. There are things commonly eaten at dinner that act like a delayed switch on your kidneys, programming them to do the majority of their filtration work at night. The first and most important is hidden salt. Most people think about salt as something that comes from the shaker on the table. But roughly 80% of the sodium most Americans consume comes from packaged and processed food. Cheese, cured meats, sandwich bread, canned soups, condiments, crackers. 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips, but you do not taste the sharpness because it is masked by fat and other flavor compounds. When you eat a cheese sandwich or a plate of cold cuts in the evening, that sodium enters your bloodstream and your body immediately holds onto every molecule of water it can to dilute the concentration. During the evening, you do not feel the effect. But overnight, your kidneys detect the accumulated sodium and begin actively excreting it, and sodium pulls water along with it. You wake up at 2 in the morning not because you drank too much. You are eliminating the fluid your body retained because of last night's dinner. The second evening problem is sugar. A small piece of fruit before bed, a couple of cookies with tea, a sweetened drink. These seem harmless. But simple carbohydrates eaten in the evening cause a rapid spike in blood sugar. Your pancreas releases a surge of insulin, and insulin, beyond its role in managing blood sugar, signals your kidneys to retain sodium and water. So first comes fluid retention. Then 2 to 3 hours later, right around when you have fallen asleep, blood sugar drops back down sharply and your kidneys switch to active fluid excretion. You wake up needing the bathroom. In people who have even a mild degree of insulin resistance, which is extremely common in Americans over 40 and usually produces no obvious symptoms, elevated blood sugar itself acts as a diuretic, pulling water out of cells and into the urine. Eating grapes or watermelon before bed can have the same effect as taking a water pill. The third evening trap is alcohol. Many people have a beer or a small glass of wine before bed, believing it helps them sleep. And it does help you fall asleep faster. Alcohol acts as a sedative on the nervous system, but it is simultaneously one of the most powerful blockers of the antidiuretic hormone we discussed earlier. Alcohol essentially cancels the brain's economy mode signal to the kidneys. Under its influence, your kidneys run at full filtration speed with no overnight restriction at all. You may sleep through the first urgency as the sedative effect keeps you under, but your bladder keeps filling until the second or third urgency becomes impossible to ignore. And the sleep quality throughout the night is poor regardless. You wake up exhausted and with a full bladder. The result is worse than if you had not had anything to drink. On the positive side, there are foods that genuinely support bladder health and calm the nighttime urgency. Raw pumpkin seeds, not roasted, not salted, just plain raw green pumpkin seeds, are one of the most underappreciated tools in everyday nutrition for this problem. They contain magnesium and zinc in forms the body absorbs efficiently. Magnesium relaxes the smooth muscle of the bladder wall, helping it expand to a larger volume before it triggers the urge to empty. The seeds also contain plant compounds that strengthen the pelvic floor and support prostate tissue in men. A small handful, about 30 grams, daily makes a real difference over time. Cranberries, either fresh, frozen, or as a standardized extract, contain compounds that prevent bacteria from sticking to the inner lining of the bladder. Even without a current infection, many adults over 40 carry a low-grade background bacterial presence in the bladder that chronically irritates its nerve endings and makes the bladder hypersensitive, firing an urgency alarm at far smaller urine volumes than it should. Cranberry reduces that chronic background irritation and calms the lining. And finally, adequate dietary fiber. A chronically constipated colon presses directly against the bladder. They share the same limited pelvic space. An overloaded colon squeezes the bladder from the outside and triggers a sense of fullness, even when the bladder is barely a quarter full. Vegetables, leafy greens, and whole grains keep the colon clear and give the bladder the space it needs to fill properly before signaling. Now let me give you the complete evening protocol that addresses the root cause of this problem directly. It takes about 20 minutes of your time and costs nothing. I call it the 3-part golden routine: morning, daytime, and evening. In the morning, before you do anything else, spend 30 seconds on what is called heel drop exercise. Stand with your feet shoulder-width apart. Rise up onto your toes by just 1 to 2 centimeters, and then let your heels drop back down to the floor with a light, firm impact. You should feel a mild vibration traveling from your calves upward through your thighs. Repeat this 30 times at roughly 1 drop per second. This simple movement activates the venous valves in your legs and stimulates the muscle pump that pushes blood upward against gravity. Done first thing in the morning, it primes your circulation for the entire day and significantly reduces fluid accumulation in the lower legs by evening. If standing is difficult due to knee or back pain, do the floor version. Lie on your back, raise both arms and legs straight up, and shake them with small rapid movements for 60 seconds. It activates lymphatic drainage and produces the same result. During the day, front-load your fluid intake. 70% of all the fluids you drink, water, tea, soup, should be consumed before 4 in the afternoon. A glass of water right after waking. Fluids throughout the morning and at lunch. After 4 in the afternoon, only small sips as needed to relieve dryness. Do not cut fluid completely. Dehydration thickens the blood and raises clotting risk. But taper down significantly after 4. Also remove the salt shaker from your table entirely. Season food only during cooking. This single habit reduces daily sodium intake by 20 to 30% without changing what you eat. In the evening, about 1 to 1.5 hours before you go to sleep, do what I call the lazy elevation. Lie down on your sofa or on the floor and put your legs up, on the armrest of the couch, on the back of a chair, or propped against the wall. Your heels need to be higher than the level of your heart. An angle of roughly 45 degrees works perfectly. Stay in that position for 15 to 20 minutes while you watch television, read, or simply rest. During those 20 minutes, gravity works for you instead of against you. The fluid that has been sitting in your leg tissue all day flows back into your bloodstream. Your heart receives the increased volume signal, releases the drainage hormone, and your kidneys shift into active filtration mode. Your bladder fills, but you are awake and in control of your evening. 30 to 40 minutes after finishing the elevation, you will feel the need to urinate and will release 300 to 400 milliliters. That is the exact volume that would otherwise have woken you at 2 in the morning. You are giving your kidneys their nighttime workload in the evening while you are awake so that when you lie down to sleep, your kidneys can rest. If you have visible swelling in your legs by evening, add a pair of graduated compression stockings. Put them on when you get home from work and wear them until your shower before bed. They prevent fluid from pooling in the lower leg tissue during the evening hours and dramatically reduce how much fluid mobilizes when you finally lie down. Finally, once you are already in bed with the lights out, do 20 to 30 repetitions of pelvic floor exercises. Most people do these incorrectly. They clench their buttocks, tighten their abdomen, and squeeze their thighs, none of which works. The correct technique: imagine you are gently trying to stop passing gas, or picture the muscles between your legs rising upward like an elevator going from the ground floor to the 5th floor. Your abdomen should stay completely soft. Your buttocks stay relaxed. Only the internal pelvic floor muscles engage. Contract and hold for 3 seconds. Slowly release. Repeat 20 to 30 times. This exercise directly tones the pelvic floor muscles and calms the neurological overactivity of the bladder, the state where it fires an urgency alarm at far too small a urine volume. A toned pelvic floor sends signals through its nerve endings to the brain that the system is stable and does not need to panic at minimal urine volumes. Here is your complete action plan for tonight. Press your thumb firmly against your shin bone for 15 seconds and check whether a pit remains when you remove it. If it does, you now know where your nighttime urine is coming from. Remove the salt shaker from your dinner table tonight. Replace processed meat and cheese at dinner with something without hidden sodium. 1 hour before bed, lie down and put your legs up on the back of your couch or against the wall for 15 to 20 minutes. Then go to the bathroom when the urge comes, and it will. Then get into bed and do 20 to 30 correct pelvic floor repetitions before you close your eyes. If you notice the pit on your shin staying after the test, if you get even slightly short of breath climbing a flight of stairs, or if your socks consistently leave grooves in your skin by evening, do not start with a urologist. Start with a cardiologist and a vascular specialist. The fluid mechanics I described today can be a sign that the heart and venous system need attention, not just the bladder. Your bladder is not your enemy. It is a signal light. It has been trying to tell you something, not about itself, but about your circulation, your fluid distribution, and your evening habits. Now you know how to address the actual cause instead of covering over the signal. Most people who follow this protocol consistently see a meaningful reduction in nighttime bathroom trips within 1 to 2 weeks. Some see it within days, not because of a pill or a supplement, but because the physics of their body has changed. The fluid that used to move through their kidneys at 2 in the morning now moves through at 9 in the evening when they are still awake and in control of their night. Start tonight. Your sleep is worth protecting.